From Lagos, the nation's commercial capital, this is the News at 10. Live from Channels Television. Reporting tonight, Millicent Walker.
Good evening and welcome. Nasarawa state government shuts down State House of Assembly after lawmaker dies from COVID-19 complications. Lagos State Governor Babajide Sanwo-Olu gives guidelines for gradual easing of lockdown, asks only level 15 officers and above to resume work on Tuesday. Less than 24 hours after the death of Emir of Rano in Kano State, another Emir from Zamfara State dies in isolation while awaiting his results of the COVID-19 test. Reprieve for bank workers as Central Bank and Bankers Committee suspend planned sacking of workers to mitigate negative impact of COVID-19 on families and livelihoods. Russia records over 10,000 confirmed cases of coronavirus in one day, with 58 deaths on Sunday alone. This later, we have sports stories. There are growing concerns in Nasarawa State over the death of a lawmaker in the State House of Assembly from COVID-19 complications. This has forced the state governor to shut down the assembly complex and embark on immediate contact tracing. The Nasarawa State Governor, Abdullahi Sule, says the closure of the House of Assembly will allow the state government to trace all the contacts of Mr. Adamu Suleiman, who is the first COVID-19 fatality in the state. He explains that the status of the lawmaker was known after his death and burial.
The member had been part of all the sittings of the members of House of Assembly, but because of his association and his contacts, we have decided that we are going to close down the House of Assembly until we trace all his contacts. I'm happy to tell you that all the members of House of Assembly, including the Speaker, have agreed to be isolated. And some of them where samples have already been taken, and they will be sent to NCDC today. And at the end of that, we are also isolating the families of the late member. Also those who attended the burial, especially those who gave the usual bath to a dead body, are also going to be isolated. So we are going to trace all the contacts of the honorable member, may his soul rest in peace, and ensure that every one of them is isolated and tested.
In the meantime, Nasarawa State Government has begun the repatriation of the first batch of Almajiris residing in the state to their home states. Governor Sule, who bade the children farewell, says none of the returning children showed any symptom of the coronavirus. He also said that their return is to ensure adequate parental care during the devastating period of the pandemic. It's also another loss. Less than 24 hours after the death of the Emir of Rano in Kano State, another Emir has died, but this time in Zamfara State, and with suspected complications from COVID-19. The Emir of Kaura Namoda in Zamfara State, Alhaji Muhammad Asha, died while undergoing treatment at an isolation center in Gusau, the state capital. The State Commissioner for Health, Mr. Yaya Kanoma, says the late Emir fell ill on Friday and was admitted at the specialist hospital. He explains that Alhaji Asha was immediately placed in isolation after he showed symptoms of COVID-19 along with his wife, while his blood sample was collected for testing. According to the commissioner, the Emir died in the early hours of today while the result of his sample was being awaited, noting that it is too early to conclude that he died of COVID-19 until his test result comes out. In the meantime, all the family members, close associates of the late Emir, has been quarantined. The federal government says it is making efforts to gain access to the new medicine remdesivir being used in the United States to treat the COVID-19 disease. The Director General of the Nigerian Center for Disease Control, NCDC, Dr. Chikwe Hekwazu, says the Nigerian government is making contact with necessary bodies to ensure the procurement of the medicine.
It's kind of a victory for science. You know, over the last few days, we've gotten emerging evidence for the first drug that has shown evidence of efficacy. It's a drug called remdesivir that came to prominence over trials to use it for the Ebola virus, where it didn't really work. So those trials did not show that it worked for Ebola. But these drugs remain in our arsenal. We now tried it in a clinical trial, and we have seen that it does produce benefit to people. And, you know, in the beginning of this outbreak, there was a lot of pressure, not just on NCDC, on state governments across the country to buy and invest in medications. I won't name them by name, but many types of pills, both conventional, medical, and everything else. And I stood firm and said, listen, we have to wait for the science to come through for us. What we now need to do is gain access to this drug. It's a difficult process at the moment, but we've started those conversations to enable access to Nigerians. We will speak with NAFDAC to hasten, speed up the regulatory process so we can make this drug accessible and available to Nigerians. So it's the first step, and that's how science works. Sometimes it's slower than we want it to be, and we would like it to be, but that's really what we have to do. And the same is for vaccines, the same for drugs, and the same for all the other measures that we need to now put in place.
The NCDC DG also gives an update on the work for a possible vaccine for the disease.
You know, vaccine development for a new disease, it's a very complex process. And what we're doing is trying to contribute to the global efforts around this. So we're going to be part of something called the Solidarity Trial, which is evaluating several, both therapeutics and vaccine candidates. Ultimately, even when you do the phase 1 and phase 2 trial of a vaccine, once you start getting to actually trying out in humans, you need people across different countries, different parts of the world, to take some of it and to show that it works and causes no harm. So we're part of a much broader global effort in different research objectives in different aspects of the response.
He was speaking earlier today on our Sunday Politics program. Now, ahead of the gradual easing of the lockdown in Lagos State, the Governor, Babajide Sanwo-Olu, has released guidelines to be followed by residents effective from tomorrow. The Governor said, among other things, that offices will reopen from Tuesday, April the 5th, but with senior civil servants on grade level 15 and above handling operation at state government parastatals. Markets to open on Tuesdays, Thursdays and Saturdays, while other non-food markets are to open on Mondays, Wednesdays and Fridays. He says schools, places of worship and recreational parks will remain shut, while banks are expected to be open from 9 a.m. to 3 p.m. The Governor also cautioned against acts that could expose residents to more danger, while asking that commercial buses should embrace physical distancing and enforce the use of face masks.
We've had to review our position, and we've actually now extended the directive that all civil servants will stay away tomorrow. All civil servants will stay away tomorrow. They should not come to work tomorrow, because we actually want to measure how people reflect and react to the unlocking. And even from Tuesday, it's only officers from grade level 15 and above have the express permission to come to work. It's only grade levels 15 and above have the express permission to come to work. All other officers that might be required, that might be critical to the service, they will be informed by the accounting officers that they are required. However, if you are needed and if you are critical to the activity of your ministry, the accounting officer will be communicating with you. Same applies to all the local governments and LCDs we have in the state. All of them will remain closed, except the ones that the local government chairman will have express instruction and permission for them to come to work. Also, regarding the markets and the open stores, I had mentioned that they will be allowed to open from the hours of 9 a.m. to 3 a.m. But the alteration we are making to that now is that the markets are going to be opening on alternate days. And what do I mean? All the food market and stores will be permitted to only open on Tuesdays, Thursdays, and Saturdays from the hours of 9 a.m. to 3 p.m. However, other markets that are selling building materials, spare parts, non-food markets will be open on Mondays, on Wednesdays, and Fridays.
The guidelines ahead of the gradual easing from the Lagos State Governor. In the meantime, there's some good news for all bank workers in Nigeria who have probably been nursing fears of being laid off due to the COVID-19 pandemic. Well, today, the Central Bank of Nigeria and the Bankers Committee agreed to suspend plans by the banks to cut down their workforce. The committee reached the agreement after a meeting where they announced that all banks in the country should stop such plans. Rather, they should help mitigate the negative impact of COVID-19 pandemic on families and livelihoods. A statement by the CBN says all banks will need the approval of the Apex Bank to sack any staff and that no bank shall retrench or lay off any staff of any cadre, including full-time and part-time. The Apex Bank is also soliciting the support of everyone to weather the economic challenges posed by COVID-19. The decision follows via reports that some banks were already planning to cut down their staff strength due to operational costs. Tomorrow, May the 4th, the reviewed lockdown announced by the President, Muhammadu Buhari, will come into effect. This next report examines the level of compliance with the ongoing lockdown order and expectations of some Lagos residents ahead of the lockdown ease.
For over 4 weeks, the lockdown has been on to check the spread of the coronavirus in Lagos and Ogun states, as well as the Federal Capital Territory. The outlook remains the same in Lagos, the epicenter of the virus, stretching through border communities. The stay-at-home order is still in force ahead of the relaxation of the lockdown. Law enforcement officers are still on the roads to ensure that government's order on the restriction of movement is observed.
We assessed how our factories.
President Muhammadu Buhari had announced a phased and gradual easing of the lockdown, considering its effect on the economy.
Many of our citizens have lost their means of livelihood. Many businesses have shut down. No country can afford the full impact of a sustained lockdown while awaiting the development of vaccines.
With this pronouncement, certain scenarios like this will be lightened in few days' time. Work and economic activities are expected to return following the new, less stringent measures. For many, the weekend offers the final window for preparation ahead of resumption. But with the partial relaxation of the lockdown, how optimistic are residents to return to work?
They are easing the lockdown from Monday. So I feel people should be able to do the needful, to be able to cope the spread of this virus. But I feel the easing of lockdown, people going back to work, it also help to improve the economy a little bit.
What Mia suggests is that government is supposed to provide means for people and let them merit kits outright lockdown so that people will not come out. That will ease the tension in the country.
Barring any unforeseen development, come May the 4th, roads, offices, markets, and certain business outfits are expected to come alive again. This relief, however, comes with a new challenge in controlling the rise in COVID-19 cases, enforcement of physical and social distancing, and promoting personal hygiene.
In part two, after the break, we have more on the lockdown ease. We bring you a report from the FCT. Also, we'll be joined by Channels Television's data analyst, Babajide Ogusowo, to review the projections for the month of May. Please stay with us. Welcome back. If you just joined us, you're watching the News at 10 live on Channels Television Lagos. A reminder of our top stories. Nasarawa State Government shuts down State House of Assembly after lawmaker dies from COVID-19 complications. Lagos State Governor Babajide Sanwo-Olu gives guidelines for gradual easing of lockdown, asks only level 15 officers and above to resume work on Tuesday, others to remain at home. Emir of Kaura Namoda in Zamfara State dies in isolation while waiting for his COVID-19 result test. And Central Bank of Nigeria and Bankers Committee suspend planned sacking of workers to mitigate negative impact of COVID-19 on families and livelihoods. Plus, Russia confirms over 10,000 cases of coronavirus in one day, 58 deaths on Sunday alone. Our website, channelstv.com, has more information on our top stories and others. Subscribe and watch Channels Television's live stream on YouTube and other social media platforms using your mobile device browser, or download the Channels TV app for Android and iOS devices from their respective stores. You can also watch us via your smart TV platforms, Apple TV, Android TV, Fire, and Roku TV. Now, residents in the nation's capital, Abuja, have mixed feelings concerning the easing of the lockdown order by the president. Our correspondent, Kayla McGrath, talks to them about the projected impact of easing the lockdown in Abuja and guidelines for the enforcement, which are supposed to keep Nigerians safe from COVID-19 while they carry out essential businesses.
There will be an overnight curfew from 8 p.m. to 6 a.m.
Prior to his address on April the 27th, President Muhammadu Buhari was accused of subjecting Nigerians to a hunger virus with a prolonged COVID-19 lockdown. At the time, the thinking was somewhat unanimous.
It will not just make a complete economic sense for us to continue 100% lockdown as we have it now.
So, President Buhari ordered that the lockdown be eased with conditions. It is less than 24 hours to the easing of the lockdown, and we want to find out if the president made the right decision.
It may now become a mistake if we refuse to do the needful. I'm happy that the guideline, which I said must be out before the easing of lockdown is enacted and is mentioned. I'm happy it's been mentioned, the release is out.
Civil society organizations do not agree with this view, especially since the number of infections and deaths from COVID-19 in the country continue to rise.
It's quite a worrisome position, but I don't envy the government, because in dealing with this situation, you are torn between this dilemma of protecting public safety or protecting livelihoods, because we're virtually an informal economy. And I'm very, very worried about easing of this lockdown. We are told by the NCDC that the curve is still rising. We've not gotten to the peak. I would expect that periodically, continuously, we educate and enlighten the people on these new guidelines that have been issued and their implications and the role that citizens have to play. But, Kayla, Nigerians have the responsibility.
The COVID-19 task force in Abuja has had their hands full with lockdown violators. Easing the lockdown means they have so much more to handle now.
The list is wide. People are going to come out so massively tomorrow. We are expecting them here. We will be manning the borders very strongly to actually guide against people coming from other states here. But no matter how much we work, we still believe that it is more better for us to appeal to persons to understand that this is a fight by a nation or by the world or mankind to stay alive than just intensive enforcement here. Like the uniform men, many became taxi drivers. Some journalists use their car to actually carry goods. We caught some journalists carrying goods. We caught some other persons who are even health workers, somebody using a pharmacy bus to carry passengers. It all depends on the conscience of the person involved and how he key into the fight against COVID-19.
The modalities of the easing of the lockdown in the nation's capital is very complicated and heavily reliant on individual responsibility. The fear is that if residents of the nation's capital do not adhere to these personal responsibility laws, that we might be seeing a reversal of all the successes that were recorded from the lockdown in the first place and see the nation's fight against COVID-19 go back to square one or worse. Kayla Megwa, Channels Television News.
The accident and emergency complex of the Federal Medical Center Idiaba Abeokuta has been temporarily shut down to allow for a thorough decontamination exercise after recording 2 coronavirus cases. The center's spokesperson, Mr. Shegun Orishajo, says the 3 suspected cases were being managed at the center within the last week, and 2 of the patients tested positive while 1 was negative. He explained that one of the patients who tested positive was a pregnant woman who died on Friday, and the second patient, a young man who is clinically stable and now transferred to an isolation center in the state. Meanwhile, staff that attended to the patients have been asked to observe the standard protocols and procedures, dispelling fears that as of now, the hospital does not have any COVID-19 patient. No fewer than 40 passengers have been arrested by the police in Oyo in Ilorin East local government area of Kwara State. The passengers, made up of men, women and even children, were concealed behind a foodstuff truck traveling from Zamfara State. The State Commissioner of Police, Mr. Kaide Egbetukun, says his men made several attempts at stopping the driver, who cited brake failure for the reason why he didn't halt. According to him, the driver used the bush path before being cited by police. Ceylon Security Police has also intercepted 11 travelers for contravening the Oyo State interstate travel ban as they attempt to sneak into Akure, the state capital, through Ibadan. The travelers explained that they were returning from Sokoto to their families in Akure after more than 4 weeks of being stranded in the northeast as a result of the COVID-19 lockdown. Governor Seyi Makinde, who visited the Gbaji police station where the men are being held, and says they will not be released until they undergo COVID-19 tests.
They claim they came from Sokoto. They must have passed through so many states to have been able to get here. We're taking the samples now. They cannot go anywhere until we get the results. So I've asked my SA Arewa to talk to Seriki Sasa, and then we'll see if we can keep them, within that community isolated until we have their result. Once we have their result, I'm also in discussion with the governor of Sokoto. We're more than likely going to return them to Sokoto. Interstate lockdown was put in place for a particular reason, and what we've said we should do is ensure that in each individual state where you have the interstate garages, those garages must be on lockdown. If those garages interstate are on lockdown, at least 80 to 85% of our problem will have been solved.
The number of COVID-19 cases in Nigeria is expected to rise in the short term. This is because the Nigerian Center for Disease Control, NCDC, says it aims is to trace and test more than 2 million Nigerians within the next 90 days. Now, as the lockdown restriction eases in some parts of the country, citizens have been asked not to let down their guards. Tonight, to share insights about the latest trends on the coronavirus in Nigeria is Babajide Ngusowo, Channels Television's data and information consultant. Thank you for joining us.
Good evening, Millicent.
All right. Now, looking at restrictions, movement of people to slow, businesses to open up from Monday, what are the expectations?
Expectations is one way to start. The other way to start is what I've realized, and that is in the last 9 weeks, we've seen that there are 3 types of Nigerians. Category 1 belongs to Nigerians who do not have the virus, and they know that they do not have the virus. That's the least dangerous category. The second category is Nigerians who have the virus and know that they have the virus. That category is a bit more dangerous than the first, but it is not so dangerous because those in that second category will be responsible. That is the expectation. The most dangerous category is Nigerians who have the coronavirus but do not know that they have the coronavirus. And I will explain a bit more about this third category before we look into the outlook for me. And here's why the third category is the most dangerous. Earlier today, the European Center for Disease Control updated their global report on the situation of the coronavirus. And here's what that report shows. It shows that among the League of Nations that have citizens of above 200 million, every of the countries in that league, countries that have a population of over 200 million, every of those countries have reported over 10,000 cases of the coronavirus, except Nigeria. Millicent, here's what it means. It means that the world either needs to learn something from Nigeria, or Nigeria needs to learn how to count. You know, by the way, speaking of counting, tomorrow, the 4th of May, what counts for most millions of Nigerians is that tomorrow they will have some freedom of movement, freedom of association, freedom perhaps to smile a bit. Oh, here is why I am worried about tomorrow, the 4th of May. You know, exactly on the 4th of May, 18 years ago, an EAS airline took off from Kano, heading to Lagos. It exploded, killing 148 people. My fear about tomorrow is another explosion may occur, but I'm sure it wouldn't be an aeroplane explosion. What's the summary of all that I'm saying? It might be easier for you to survive being run down by a train than for you to survive going out from tomorrow without that face mask. So let's quickly start tonight's analysis. There are three things I'd like to quickly talk about. The first is, how did we get here? I'm talking about we've now crossed the 2,000 mark. The second thing is, what is the outlook for me? And if we have some time, I'll share with you why Nigerians should put on a bit of a smile. So let's start with, how did we get here? We've crossed the 2,000 case mark. And if we take a look at the journey to 2,000 cases, here's what you'll find. We've seen that, yes, the first case was reported on the 27th of February. 4 weeks after, on that Sunday that I was here, we had only 30 cases. A week after, we moved into triple digits. And now we're in quadruple digits. That is the journey to 2,000 cases in 9 weeks. But here's another second thing that I would like us to take a quick look at, which is, what is the outlook of May if we are to summarize all what has happened in that journey to 2,000 cases and be able to use the trends as a way to project what could happen in May? And here's what you find if we take a look at the projections for May. The first is that in February, when February ended, there was only one state that had a case of coronavirus, which was Lagos, and so we ended February with only one state, one case. By the end of March, we had 11 states, including the FCT, and we had 139 cases on the last day of March. On the last day of April, we had 34 states, including the FCT, and on the last day, we had 1,932 cases. Based on this evidence and looking at these trends, it means that it will be more than a miracle for us to end May with less than 10,000 cases.
Very interesting. But quickly, I can see the patches of white, and that's Kogi and Cross River. What's special about them?
Perhaps nothing special about Kogi and Cross River. Kogi and Cross River are the only two states that officially the NCDC hasn't reported any case. But should the families living in Kogi and Cross River smile? I have a different perspective. I think all the states have it, and I'll explain why. Yes, officially, Cross River doesn't have any case of reported of the coronavirus. But let's remember, Millicent, Akwa Ibom was created out of Cross River. Akwa Ibom now has 16 cases. Oh, yes, Kogi officially doesn't have any reported case of the coronavirus. But let's remember, Kwara and Benue State were created out of Kogi. And if you look at that perspective, yes, we then could understand that, yes, officially, we might not see numbers from Cross River and Kogi State, but you don't want me to share why Nigerians should smile.
I wish we had more. I wish we had more time.
Or sometime next week, I'll share with you why we should smile a bit.
All right, we appreciate your time, Babajide.
The pleasure is all mine. Remember, there are 3 types of Nigerians, and I know which category you belong to.
I remember them. And when the News at 10 returns, as the world marks Press Freedom Day, we examine the challenges faced by journalists in carrying out their duties without fear. We'll be joined by the director of the International Press Council. Please join us again. Many have hailed and continue to hail efforts of health workers on the front of the COVID-19 pandemic. Some attention may have been shifted away from the Nigeria Center for Disease Control, NCDC, which is leading the fight against the pandemic in Nigeria. Some staff of the center have also, in the course of doing their work, been infected with the coronavirus. In this special report, our correspondent Terry Kumi goes behind the scenes with the disease control body.
The NCDC boss arrives the headquarters of the Nigeria Center for Disease Control at about 6:30 p.m., right after the daily briefing of the Presidential Task Force, which is part of a series of engagements that have turned into a daily routine for him since the outbreak of COVID-19 in Nigeria. He heads straight into his office and to his computer to respond to mails and some other pressing updates. We have 5 minutes before he begins a teleconference. The man who has not had a decent night rest in over a month talks us through his life now as head of the NCDC.
I'm here 8 a.m. in the morning. I hardly leave till 11 p.m. or 12 or 1 a.m. And this is really how it works every day. But really, when I leave here at 1 a.m. or some nights, I don't leave because the work is done. I leave because it gets to the point where you can't do anymore.
He says they have had their own share of confirmed COVID-19 cases.
In the midst of all of this, a few of my staff actually got infected themselves. So I had to now take out 30 minutes to speak to each of them. A very important responsibility of any leader, to speak to each of them and assure them that despite the challenges, despite their being infected, that we are there for them.
The NCDC is a small body with a staff strength of about 200. The Call and Connect Center of the NCDC is just as small and predominantly made up of volunteers who practically work around the clock.
On a normal day, we usually have about 50 to 100 calls in the whole week or month, but now we have over 500 calls.
Many have accused the NCDC of not responding appropriately to their calls. They explain why.
Some people will claim they have cough and when they have coronavirus, and when you talk to them further, you realize that they're just trying to prank you, play around with it. And then we have other people calling just because they are hungry, due to the lockdown and everything.
The NCDC, contrary to public perception, does not collect samples of suspected COVID-19 cases. The Public Health Department of the state, in this case the FCT, does, and transmits those samples to the molecular lab of the NCDC, which we are not allowed to film. At the NCDC, it is one conference after another, working round the clock for updates per minute.
So this is the Coronavirus Emergency Operations Center, where the national response to the COVID-19 outbreak is being coordinated.
While the disease control body battles with the COVID-19 pandemic, it says it is not unmindful of the Lassa fever outbreak, which the country is still battling, along with other diseases.
The Inspector General of Police, Mohammed Adamu, has warned against attacks on policemen deployed for the enforcement of the COVID-19 lockdown. The police chief says since the commencement of the COVID-19 enforcement duties, a total of 27 police personnel have suffered series of attacks and assaults from members of the public at different times in different locations. He explains that the trend will no longer be tolerated by the force. He also cited cases of attacks on police facilities and assets in in Katsina and Abia states. The IGP appeals to the public to continue to cooperate with the police and other security personnel and voluntarily comply with all its COVID-19 prevention orders. For more on the plight of journalists, we're now being joined on the news at 10 by the executive director, that is, of the International Press Center, Mr. Lanre Arogundade. Thank you for joining us.
Thank you very much. Good evening.
All right. Now, these are definitely unusual times for everyone, especially journalists. But what do you think the current challenges of the journalism profession is?
Well, you know, when you were reading that piece of news about the Inspector General of Police warning against attacks, I thought you were going to proceed to say the IGP has warned against attacks on journalists in the course of covering COVID-19, because that speaks to the first challenge that we face, the fact that we're not properly recognized as frontline workers, frontline men and women when it comes to this COVID-19, to the extent that since the pandemic started in Nigeria, we've documented up to 22 instances of attacks on journalists. In Adamawa State alone, 12 journalists were attacked on one day. So we have a disconnect. On the one hand, the president, quite rightfully, in his statement today, acknowledged the role that the media is playing in the fight against COVID-19. But we do not see this translate into the understanding and appreciation of that role in terms of stopping all these attacks, in terms of the federal government and the state government, giving our colleagues who work with the state government, who cover their briefings every day, a special insurance package to recognize, the dangers that they face. In terms of also giving us that resources, we think that one of the challenges we face is that Nigerian journalists are not well-resourced and equipped to cover this pandemic. And this is because this is the first time that the current generation of journalists, irrespective of age, are covering a pandemic for the first time, because the last one was 1918 to 1920. So we like to see the fact that when we are recognized as frontline men and women, some of these challenges, government needs to do something about them.
So what's the reality of the practice of journalism without fear or favor in Nigeria?
It's difficult to say. When you talk about journalism without fear or favor, we could say that where we are, because journalists have practiced without fear. If you look at the military period, a number of our colleagues really went out, and media put itself at the vanguard for the struggle for democracy, and to that extent, we were able to have democratic rule by 1999. But under the current situation, we cannot say that we practice journalism without fear. I've mentioned, this instance of attack. As we speak, a number of our colleagues are in detention or are facing one trial or the other. And on this occasion, actually, we're also calling on, President Buhari, in line with the statement he made, to follow the advice of the Secretary General of the United Nations, who in his April 23 policy brief on COVID-19 and human rights, actually called on member states, to consider the release of people who are being held in prison, maybe as prisoners on political grounds, and including, journalists. That would be fine. Would like to see, the likes of, Showore, the likes of, Jalingo, set free during this period, because it's a very difficult period. Now, in terms of favor, again, it's difficult to talk about journalism, without favor. If you look at the ownership structure in the broadcast media, for example, it's about 80% government owned. So our colleagues in the broadcast media would always look at the back of their heads to look at what the government is thinking for them to practice, because that independence is not there. In some private media, certainly not China's television, we do know that the proprietors have political interests. So to that extent, there is a fear of repercussion that if you use certain types of news, maybe you would have crossed the red line of the political interests of your employers. So I feel that ownership really makes it difficult for us to have journalism without favor. But for journalism without fear, really, it's also very, very difficult. And I think that on this occasion of May Day, we need to seek greater understanding. If there's anything that COVID-19 pandemic has shown, it has really shown the important place of the media in the scheme of things. Despite the fact that you have problems, of fake news and so on, it is to the conventional media that our governments are turning to get the kind of information they want to get across, to the public, for them to be able to do that.
All right, we appreciate your time on the News at 10. Executive Director, International Press Center, Mr. Lanre Arogundade. Thank you for joining us.
Thank you very much.
Still ahead on the news at 10, Russia records over 10,000 confirmed cases of coronavirus in one day, with 58 deaths on Sunday alone. We have that story and more. Please stay with us. And many students in Delta State have taken advantage of the teleclasses organized and broadcast on television and radio by the state governments to ensure that learning continues during the COVID-19 pandemic. Schools have been shut as a measure to contain the deadly virus, but the state government hopes that the teleclasses will help students, especially those in the junior and secondary schools preparing for the external certificate examinations, are prepared.
Schools and most learning centers are shut down as a necessary measure to contain the spread of COVID-19, an indication that the global health crisis has no doubt affected education. Closed gates and empty seats are common sights at all schools in Delta State. But even with the lockdown, the state government is ensuring that the academic calendar of primary and secondary schools is not seriously disrupted through its teleclass initiative, which runs on radio and television on weekdays. This is Okpanam community in the suburbs of Asaba, the Delta State capital. The calm environment helps the children here to concentrate on carrying on with learning. Some of them take advantage of the teleclasses via television, and for others who do not have access to the tube, they learn through the radio.
I appreciate them for this teleclass which they have used to help us, because most of the times we stay indoor without doing anything, but with this teleclass we are able to recall what they have taught us in school. We appreciate them, we thank them.
Their parents commend the state government for the initiative.
I really appreciate Senator Dr. Ifeanyi Okowa. He tried for us, because if not for him, I don't know where we would have been for this period. There is no anywhere they're organizing lessons for children. So with this, they make them to be occupied.
Arrangements are also being made for children in the rural and remote areas with challenges of power supply and network for internet.
We're able to take in the capital territory 3 radio stations, in Warri area 3 radio stations, and in Central we're able to reach the rural areas adequately, because it will be very difficult for you to see any part of Delta where you cannot get radio, and it's cheaper for you to run with battery than running with diesel or light.
There are also plans to incorporate e-learning, which will be interactive, but in the meantime, all episodes of the classes are being uploaded via the various social media handles operated by the government.
And as the number of COVID-19 cases increase worldwide, Russia is making its way onto the map, recording more than 10,000 infections in the past 24 hours. This comes as U.S. officials say millions of American businesses have been taking relief loans since April 27 through a government's coronavirus relief package. In the meantime, many cities worldwide are eager to ease lockdown measures aimed at curbing the coronavirus in a bid to boost economies.
The number of people globally who have contracted the coronavirus is nearing 3.5 million, with the United States recording the highest number of cases at more than 1 million and over 300,000 in New York. But that has not stopped half of the states in the country, led by Texas and Georgia, to begin reopening the economy, while California and New York remain under imposed restrictions. Across Texas, major employers were putting plans to bring staff back to their offices. Italy's business owners are preparing for phase 2 of a staggered economic reopening. From Monday, May 4th, some measures are being lifted in the country that has experienced Europe's longest coronavirus lockdown, bringing hope of the country returning to something nearing normal. In the end, however, many of the restrictions of the past 8 weeks will remain in place, while confusion reigns over those that will be lifted. Spain has eased lockdown restrictions as it marked the lowest one-day death toll increase since March 18th. The government has implemented a shift system, allocating different time slots to different age groups. The relaxation of exercise restrictions is one of the first steps in a 4-phase plan to gradually reopen the country by the end of June. Russia has been under lockdown for nearly 5 weeks, but residents are observing the lockdown more strictly compared to the past week. Today, it recorded its biggest one-day increase in new cases since the start of the outbreak, with more than 10,000 people testing positive. The country now has nearly 135,000 coronavirus cases. It is now among countries where the mortality rate is rising fastest, roughly doubling the number of deaths in the last 10 days. On the other hand, South Korea would be one of the few countries to relax social distancing rules starting May 6th, allowing a phased reopening of businesses as the nation has largely managed to bring the coronavirus outbreak under control.
And the main news again. Nasarawa state government today shut down the State House of Assembly after a lawmaker died from COVID-19 complications. Also today, Lagos State Governor Babajide Sanwo-Olu gave guidelines for gradual easing of lockdown. He asked only level 15 officers and above to resume work on Tuesday, while others are to remain at home. And that's the news at 10 tonight. Many thanks for watching. I'm Millicent Walker, and as you go out tomorrow, stay healthy, stay safe.